good morning, and good morning to you on this rainy Saturday morning. Another new month. What a joy, what a blessing, what a privilege to come your way. And thank you, as always, for allowing us into your space, whatever that space is, whether it's in the vehicle, it's at home, it's in the office, it's in the workshop, you are doing some laundry, whatever it is. We thank you so much that we do this together. This is Farm Life, your regular family enrichment program, live here on City 97.3 FM, on our affiliate stations, and on the internet. My name is Michael Mensah, and we do this together, and we do meaningful and important topics that help us to be better. We always say this here, that we acknowledge that we are work in progress, not as a lame excuse not to be better, but as a positive posture to help us have the attitude of a learner, because the biggest room in the world is the room for improvement. And when we tend to get that well, it changes the dynamic of what we do or do not do. For this month of July, we'll be looking at what I call my 10, with a dimension called quick tips. So here we go. The first in the series in this month of July. Quick tips. The dynamics of effective parenting. Every parent needs to understand that there are certain P's that they need to give attention to. Every parent often focuses on some. It's been said that most of the time, dads are found to be more guilty. That used to be the case in many years gone by. That dynamic is fast changing. Now we have more dads being more into the other aspects than what they used to do mainly in the past. Now we also tend to have now some moms also now taking that posture of dads as it used to be the conventional posture, and are rather sometimes reneging on doing all the other things that I am going to talk about briefly, and which are necessary for the functioning of the family and for growing up of the children and for bringing them up in the way that they should go, so they can become well-rounded young adults and adults eventually. It all starts with when we are bringing them up. So take note, dear parent, whether you are co-parenting both mom and dad, whether you're a grandparent who is parenting, whether you're a sibling, older sibling parent who is parenting, whether you are a sibling, that's an auntie or an uncle who is parenting, whether you are a cousin who is parenting, whatever kind of parent you are, whether you are a foster parent or an adoptive parent, all these things, or you're a parent figure doing it occasionally, these 7 P's are necessary for each one of us to look at closer, study more deeply, and work on to become effective parents. The first one, which most parents focus on, is provision. Now, provision is high and huge and carries probably the highest weight of all the 7. It includes providing for their basic needs: food, shelter, clothing, their education needs, their fun or leisure needs, their social needs, their positive learning talents and traits, including music, arts, dance, drama, and what have you. So provision is the number 1. Every parent must provide to the best of their ability for their children, prioritizing their well-being, not just theirs as parents, as some parents are wont to do. And a lot of men do well, and some women too. But now we are seeing that in a partnership, or whatever kind of parent you are, do still prioritize parenting I do still prioritize provision, as is still a major one. The next one is protection. Now, every child needs to be protected by the parent or parents. Protection from harm, so that's the physical protection, giving them a roof over their head, keeping them safe from any and every form of harm, that is physical. Then there is social protection, keeping them from negative influences of the system, the society, whether it's a school setting, whether it's a neighborhood you live in, whether it's other extended family members who can cause them harm, whether it's their friends, the kind of friends they move about with or do things with. So every parent needs to offer social protection in addition to physical protection. Every parent also needs to offer technological protection, which is also an extension of the social protection. And that is, in this age of social media and technological advancements, the world is in the palm of the hand of the child, right from age 2 all the way to being young adults. And so it's very important, or it's incumbent of every parent to be sure that they technologically protect their children. Make sure that they are engaging with content that is age appropriate. Don't expose them too early to gadgets and social media. If you are aware, some of the advanced countries are passing laws for their children not to engage social media till they are even 16. Some are now going back to asking that the children learn to write with pens and scribble rather than do it on tablets and phones. Why so? Because the effective locomotion and the development of the gray matter of the child can be greatly reduced if they rely on AI and spend long hours on social media where they can engage with content that may not be wholesome or helpful to them. So social protection is key and technological protection is key. Then the next one is spiritual protection. We are three in one, what we call the trichotomy of the human being. We are spirits, we have a soul, and we live in the body. Believe it or not, even those who claim that they do not believe were all excited when a certain Paul, called Octopus Paul, in the 2010 election in World Cup, was making predictions of matches, and the whole world was agog and excited at what they call psychic Paul. But when the same Apostle Paul talks about prophecies and about happenings and about stuff to happen, we take exception and are not happy about. And so, protect your children spiritually as well. Pray for them, teach them to pray, teach them to know God, and to serve Him faithfully and to have a true relationship with Him. The next one, which is the third, is presence. Be available. Be available to your children. Let them have access to you, even when you are not physically present. Let them be able to reach you through other means, whether by phone, video, phone call. But don't just be a protector. Don't just be a provider. Be present in their lives so that they know that I can get to mommy, I can get to daddy. Don't let your work, your business, your chasing of the money, your rising to the top take all the time. Factor them into your activities, and therefore so that they can get to you when all is well and when all is not well. Number 4 is participation. Be present, participate in their lives. Do not leave it to chance. Be involved in what concerns them. Play with them when they are young, engage them, have dates. If you have multi-children, date them one by one, ask them questions about what they do, how they find the family, what they don't like about the family, engage them, what makes them happy, the kind of friends they have, maybe some you may not know. Be involved. Go for PTA meetings, go for things that concern them, take them out. Taking them out doesn't have to be expensive. You can just even go for a stroll. So be involved, that is participate in their life. The 5th one is principled guidance. Now, training a child is part of the nurturing process, and it does not just happen from the sky. It happens by everyday mundane activities, routines, regulations, boundaries, operations, activities, values, principles, ethics. And so that is where the mentoring, the discipling, the modeling, the training and everything happens. Now, training is instruction plus practice. So as you're instructing them and teaching them, give them opportunity to actualize or practice what you are teaching them. Then you are training them. And then do that and also be a good example, because children do more what they see far more than what they are told or they hear. Number 6 is preparation. Prepare them as they are growing up for the world of love, the world of work, the world of community, the world of ministry, the world of service, the world of volunteerism, and the world of Ubuntu. I am because you are. Consideration for the other and running and doing things effectively, because they would grow up to become the next adults. And how you shape them and prepare them for those things. Some are not prepared to be good spouses, and so though they are high in IQ, have good jobs, make big money, that is all there is to their name. But as a parent, teach them to have all the dynamics that will make them good and suitable. And then the final one is what the family ethos or essence is: preservation. Teach them to carry on the culture of the family that is good, the value systems, the principles, the ethos, the character, the culture of the family. Let them carry it on into their family, and then let them teach their children. Let it keep going. By so doing, we are building a legacy of continuity. So the 7 P's, again I'm going, is provision, protection, presence, participation, principled guidance, preparation, and finally preservation. And when we do this, we can get good outcomes, and we can raise our children holistically. They can be fit and good to go for everything. Please stick and stay. So that is my turn, and that is the quick issues to consider whilst we delve into the substance of our meeting here today. Continuation and building up further on that. So we are looking at the mental health in the family. And we have a very special person to join us today to do that conversation. And then another person who is a regular will be joining him. So today is his first, and I know it will not be his last. I've had the opportunity to listen to him on Zoom seminars and presentations, and he's awesome. He's deep, and he shares very practical and professional information that will help make us better persons. So drum roll for his first appearance here at Farm Life at the beginning. I'm hopeful. He's Dr. Isaac Newman Arthur. He's a medical director and clinical health psychologist at UPSA. He's a PRO of the Ghana Psychological Association. And so we are going to do that. Please help us and help me welcome Dr. Isaac Newman Arthur. Ramro, we are welcome, Doc.
Thank you. Thank you.
All right. And then the regular, I call my fair lady, who is a counseling psychologist with the Ghana Atomic Energy Commission Hospital and Medis Clinic at Shado. One and only fair lady, Lady Justina Owu-Agyiri. Welcome, my dear sister, as well.
Thank you.
All right, so we are good to go. We are in good company. We have 2 people who are into clinical psychology and to counseling psychology to help us navigate the conversation we started last week to another level. So we are narrowing down and limiting to mental health in the family. And we're going to start from the perspective of the children, and then we'll come back to look at that for the couples, which is the elephant always in the room. Doc, good morning once again.
Good night.
You see,
my sleep didn't reach me.
Oh, Charlie, sorry. Black Stars broke our heart.
Oh, me.
I didn't watch. I don't know. I dozed off I started watching, and when the goal came, I don't know what time I dozed off. Then I came back, I woke up again and watched the rest.
Me, I don't,
and then
I
before,
don't watch you.
You don't want. At that point, my house said no. They will listen to the scores in the morning.
but why,
so I'm the only one who was watching.
When I woke up, I knew we had lost
because
there
the
was
vibe.
no noise. If we had scored, I would have had some goal in my
You
sleep.
see you. So thank you for waking up and come. Saturday morning is difficult, and thank you so much. We are very grateful for your sacrifice.
Thank
Look, mental health, often when people hear it, that word mental health, they think about it from very many, often negative dimensions. Please take us through what is mental health generally, and then how does mental health broadly in the family look like? So a husband, dad, mom, children, or mom, children, dad, children, or whatever kind of family it is. Yes.
So thank you very much, and greetings to all listeners. I think that over the years, our understanding of what mental health looks like, though the understanding has always been there, but now it's a bit better. You know, everybody now, everywhere you turn to mental health, everywhere you turn to mental health, right? And so mental health actually is part of health. That is why there is health associated with it.
Okay.
It's part of health. And so there are 4 dimensions of health. We have physical, mental, social, and spiritual. These are the 4 dimensions, right? And what we are really familiar with and people understand better is the physical aspect of health. And that has to do with your body systems and function. You have a heart, you have a kidney, you have a liver, brain. They all have a certain physiological activity. So blood is moving and stuff like that. And so when any of the organs or the systems are not working well, then you have a physical disease.
Okay.
Right? So someone may vomit, have diarrhea, is bleeding, or sugar is up, or BP is up. So you go to the hospital usually with physical health problems.
Okay.
Right? That is what people know. It's a typical thing. Nobody goes to their HR and say, I'm tired, give me 3 days off. Or I feel depressed. You know, we all go when there is some physical illness.
Okay.
So that has taken root. And we all understand what physical health really is. Right? And so, and the 3 other dimensions, mental, social, spiritual. Mental, social is your relationships, economic issues, tradition, culture. Now social media has become a big thing now.
Yes.
Cyberbullying. There are 2 terms, nomophobia, absence of phone, and the anxiety relating with that. We have netless phobia, when you can't connect to an internet, and the anxiety relating to that, fear of missing out. Those things are all social related things. Right? Then spirituality, all the things we understand about spirituality, beyond demons and demon possession and curse and stuff. We look at values, virtues. We look at connectedness to yourself, to others, to creation, to the divine. Right? Then depending on the religion you come from, it has many, many permutations. So all those things determine your well-being, including mental health. Right? So the mental health is kind of part of the 4. And these are official definitions, you know, in all healthcare settings. And that is where we look at holistic healthcare, where we look at all the 4 dimensions. Right? So mental health is also part of it. You know, and when it comes to mental health, people's mind goes to respectively someone lying on the streets. And those are extreme forms of mental disorders. Extreme. Right? But we have others. So mental health really looks at how you think, feel, and behave. Your thinking, feelings, and behavior. And how that thinking or feelings or behavior is impacting your life. Right? So all mental health issues are categorized around this thinking, feelings, behavior. Thinking, feelings, behavior. So if you have a thinking or feelings or behavior, that is impacting you significantly. What it means that you are in some distress, or you are not able to function, you wake up, day-to-day activity becomes difficult, your work is suffering, your marriage is suffering, your relationship is suffering, because of how you are thinking, feeling, or behaving. Or you realize that you can't fit into social spaces. Right? It means that you become a bit dysfunctional. So that is what mental health really looks like. How you think, feel, and behave, and that is how that is impacting your life. Right? But there are differences. We have, you may have an impaired mental well-being, but you don't have a mental illness. Right? Impaired mental well-being means that probably your thinking, feelings, and behavior is all over the place, but it does not satisfy any diagnostic criteria to warrant a disorder. And all of us, you know, day to day, you know, we feel some way. we are not happy small, we're excited small, we are angry small, and the body has a way of coping and adjusting. The body really adjusts. Like this morning, I feel overwhelmed, but your body actually adjusts. I can say probably this morning my mental well-being is impaired, but I'm coping nicely. But I don't have a disorder yet. Disorders come up when you have a thinking or feelings or behavior that is severe enough to impair your functioning over a certain period. Right, then we go into a discussion of a disorder. So you can actually feel depressed, but you don't have major depressive disorder. Right, so for example, you wake up, you feel sad, you're unhappy. That is part of life, and at that moment your mental well-being is impacted, but you don't have a disorder. But when we have a group of symptoms over a certain duration and it satisfies a certain diagnostic criteria of major depressive disorder, then we can go and say that you have depression. Right. So for example, you may feel sad, but you don't have depression. You may feel you may have lost a certain interest in something, but it doesn't mean you have depression. But for the diagnosis of, let's say, major depressive disorder, you need at least, you should have low mood or loss of interest, right? Plus other symptoms like poor sleep, poor concentration, attention, sadness. You may have a group of symptoms that should have been present for more than 2 weeks. And every mental disorder has its own categorization. But particularly, there's an impact on your thinking, feelings, and behavior. And that should have been there for a certain duration. Most of the anxiety-related disorders, so you have several mental disorders. We have the anxiety-related disorder, which is the most prevalent of the disorders. So generalized anxiety issues where someone is anxious over various settings. We have social anxiety, we have all the agoraphobia, we have the panic disorders, we have the fear-related problems like the, fear of specific things, right? Some are afraid of height and stuff. Those are anxiety issues. We have the mood issues like depression. We have the bipolar-related disorders. Then we have the psychotic issues. Those are the normal madness-related problems you can think about. Right. Then we have the personality issues. People have issues with how they see the world, evaluate others, and evaluate their own lives, and are able to interact with the world around them. We have the neurocognitive disorders, particularly when people are aging, multiple brain area problems. So they have memory issues, personality issues. They may have poor cognitive function and stuff like that. So those are there. So you have adults who get missing in town and the rest. A grandma who get lost or starts having some paranoid hallucinations, and sometimes they will be branded as witches and the rest, right? Then we have the neurodevelopmental issues you found in children. The autisms, the attention deficit problems, and all that. You may find that in children, right? Then we have the sex-related problems. All sex-related problems are the mental health. Those who don't have desire for sex or satisfaction for sex, regardless of how the performance is, and those who are averse to sex. Sex is a bit disgusting for them. Those who have abnormal sexual desires, we call the paraphilias. So those who have pedophilia, we have zoophilia. Pedophilia, those who are interested in children. Zoophilia, animals. We have frotteurism, voyeurism, and all that. There are several, and addictions, sex-related addictions. Pornography, masturbation-related addictions. Right. Then we have the substance use problems and addictive behaviors. So addictions to alcohol, to gambling, to marijuana, cocaine, and all that. Then we have the impulse control problems. People have difficulties in controlling their urges and their impulses. We have the sleep issues. Those who sleep too much and too little. Those who have night terrors and all that. Restless leg and the rest. Sleep apnea. And those other problems. Then we have the feeding problems, anorexia and the rest. Then we have psychosocial issues like marital-related problems, financial issues, career-related problems. Then we have pregnancy-related problems. Like we have the postpartum depression, postpartum psychosis, and those things. So mental health is a bit broad. And whatever I mentioned is small. And there are plenty of things. Right? And if you realize all the things I've mentioned, every age and what is important. So a baby in the womb can start having mental problems. A baby in the womb. Yeah, because the brain actually goes to various developmental stages right from the womb.
Okay.
Right from conception, there are all kinds of, cell division and, cell multiplication and differentiation and whatever, right from the womb, right? But from the third, fourth, fifth week, you realize that the brain and the nervous system starts, our capacity to function mentally is because we have a brain.
Yes.
And that brain is the seat for all mental processes.
Okay.
Right? So we have the mind and we have the brain. The mind looks at the mental processes and stuff. The brain itself is the hard substance.
Okay.
Right? That if you cut your skull open, you see it.
Okay.
And every part of the brain actually is responsible for a certain function.
Okay.
Right? So it's the brain that helps us to be mentally functional. And your mind basically is the cognitive process, all the process, conscious and unconscious processes of the brain.
Okay.
Right? And so if you look at that, you realize that the brain actually starts developing right from our third, fourth, fifth week in the womb. That is when it starts developing. And various parts of the brain is functioning. Right? So brain development itself influences mental health.
Okay.
That is the first point, the quality of the brain. And everything that affects the mother affects the brain. Everything that affects the mother affects the brain.
So what should be the posture of the mother, and then the posture, if she's married, what should be the posture of the partner or the spouse in helping her to have the best form of well-being so that they...
Yes, so physical things, nutrition, whatever the mother is feeding is affecting the baby.
Okay.
Right? So you go to also, there are some medications they will give to balance the nutrition. They will give you folic acid and stuff, which is very good for brain development.
Okay.
Infections, if a mother is unwell, some of the infections can affect the baby in the womb.
Okay.
Maternal issues like diabetes, hypertension. And there are some genetic issues that can happen in the womb. Such that now the brain the baby doesn't have the capacity to develop well, right? Those are the physical things when it comes to taking medications you are not supposed to take.
Okay.
It can be herbal medication or normal prescription medication. Okay. You go and buy some medication over the counter without a doctor's prescription. It affects the brain development. So there are some kids, the capacity to mentally healthy is actually not there. Okay. Then again, to the emotional state of the mother affects the child. Right, so a mother who is going through depressive problem, anxiety problems, all those changes, the child is responding to all those things. All right. Then again, delivery issues. Okay. If preterm delivery and all that can affect the child's development. And again, when a prolonged labor, there is something that happens called birth asphyxia. Okay. And when at the time the baby actually has to come out quickly. Okay. Usually depending on, it may take up to about 10 hours, 12 hours. But the moment it extends 16, 24 hours, 48 hours, and attention is not paid well to the baby, right? Before you realize, the nurses will come and listen and realize that the baby's heart rate is too high or too low. The baby has started pooing. When they are checking down there, they are checking the liquor, color, and the rest. Okay. The moment they see green, say, we have to go and do this because the baby is in distress. Okay. Because whilst you're in labor, placenta is also separating. So oxygen delivery to the child is going down. Okay. So it's just like you, an adult, and they put your head in water, and you are choking. That's how the baby feels that. Okay. And that impaired blood flow to the brain actually destroys the brain. Okay. So there are some kids right at birth. So they come out of the womb, right, and they are not crying. And the doctors will actually have to perform something on the child for the child to start crying. Okay. When the moment you see that, know that some problems have happened. So some children actually, start growing, on the wrong footing. Okay. They don't have the capacity to be mentally okay. So you see that in delays in their developmental milestones. Okay. Neck control, it doesn't happen at the right time. The smiling with parents doesn't happen. Sitting, walking, speech is a problem. Before you realize, social skills are affected. They don't play like every other child. Okay. They may become hyperactive or socially isolated. They may have some movement problems like cerebral palsy and the rest. So you have the autism-related problem, even intellectual problems, disability and learning disability. Because of that, the child goes to school and they can perform like every other child.
So does it mean that parents need to be more knowledgeable, because sometimes they put undue pressure on the child?
Perfect. The parents have to be. So pregnancy issues, father, mother, work together. Right? If the mother is stressed during pregnancy, it affects the child. So the father has to ease the responsibility of the mother. They have to work together. When the child is being born, social support is very, very important. Right? Because navigating the early phases of after delivery is important. That's why some women may go into postpartum depression. Right? And some may even go mad after that. Mothers who want to kill their child when the child is born, they neglect the child, they are more teary, they don't want to see their child. Postpartum depression, everybody expects their mother to be happy. But really, there's a crash in hormones. Estrogen and stuff crashes right after delivery. And those hormones are the ones that, maintains maternal mood and stuff. So before there are increased risks of developing all that. And it's going to affect the child care and the home. And it starts right from there. So even bonding with the child becomes difficult. Right now we know that emotional development and stuff starts in the womb and also during breastfeeding. Whilst you are breastfeeding the child, it's not just the milk, but it's the interaction with the baby. Whilst you interact with the baby, they are forming secure attachments and also proper emotional development. Now we know breastfed kids actually develop better than those who are not breastfed.
For a long time that theory was not presented to us. We were told that we should use formula food. And then yes. Now there's the reverse saying that
now even there's this kangaroo mother feeding whatever program where even if whatever they put a pouch and the baby is in there and even the father can, but it is the close contact, that interaction. That is what helps proper emotional development. Now they go to crèche very, very early. They are abandoned, with strangers. That state is what impairs their proper mental development.
Let's go there. Let's talk about attachments. You spoke about secure attachment. There's insecure attachment with all the many shades, that dismissive, that avoidant and all. Please take us on that note. And then now, let me announce. Please, if you're just joining us, this Farm Life, your regular family enrichment program, live here on City 97.3 FM, on our affiliate stations and on the internet. We are discussing mental health in the family, and with me is Dr. Newman Arthur and our own fair lady Justina Owu-Agyiri. We started off on a good loop so far. Keep your comments, queries, questions coming, because Doctor is a clinical health psychologist, and he's going to support us together with our own lady Justina Owu-Agyiri. So keep your comments, queries, questions coming via WhatsApp on 0539986996. We will also open the phone lines, so if you have some questions and stuff to ask, you can do so. Please, Doc, now take me on the issue of the attachment. Then, lady, I'll come to you shortly.
Yes. So attachment in simple terms. Every human being, we're all created as social beings. Right? And even if you look at the animal kingdom, there's a lot of socialization going on. Your family is closely knit. The feeling that I belong to this person, I am loved by this person, this is where I belong, I'm needed, I'm wanted, right? The ability to have that close kind of relationship with others. That is what attachment really is. Right? And so there are people who, for some reason, do not have that. And attachments are actually formed through, relationships. So that is why, and attachments, there's a whole neurobiological thing around it. There's a chemical called oxytocin. It's called a bonding hormone. Right? Whilst you interact with people, you form that kind of close attachments with them. And we need that for proper development. If a child does not get that, that child does not develop well. Before you realize, going into people is difficult. Trusting people is difficult. Learning to be in the company of others is difficult. because you did not develop that.
Okay.
So children who go through adverse childhood experiences, from breastfeeding time, from the fact that you are not allowed to play. Every child has to play, otherwise they are not developing well.
Okay.
Playing with other kids, they are learning how to bond with others.
Okay.
If that is not there, then they may have all kinds of attachment styles, for insecure attachment problems, and avoidant attachment issues and stuff like that. They begin to avoid people.
Okay.
They begin not to feel safe around people, right? They begin to feel, they fail to trust other people and stuff like that, right? So that is basically what the concept looks like.
Okay.
And you need proper, secure attachment to be able to bond with your family,
Okay.
to bond with your own children, to bond with your husband.
Okay.
You see, some people are, let's say, for example, they are married. Even hugging their children is difficult.
Yes.
Spending time with them is difficult.
Yes.
Being emotionally available and vulnerable to them is difficult because they never develop that.
Okay.
You have a father who struggles to be in the presence or be present at home because they don't have that.
Okay.
Right? Some kids are growing up and they don't feel that sense of connectedness to their parents.
Okay.
And we all form attachments to our cars, to our phones, to our job place, and stuff like that, because we find some level of security, some level of fulfillment and acceptance and love or warmth wherever we find ourselves.
Okay.
So if that is not happening, it translates into poor parenting, translates into a poor relationship amongst couples and stuff like that. And it didn't start now. It started way from childhood.
Okay.
And that is why some people may start relationships, every relationship fails, because they don't have that. And you find out that those people are emotionally sensitive, they are hyper vigilant, they are overly emotional, they may have anger issues, jealousy problems, trust issues. They may even be emotionally manipulative at some point because they have grown to use those emotions to get whatever they want.
Awesome.
Otherwise, it actually create problems for them.
Awesome. Lady G, let me come to you as well. Now we are looking at the sibling element. How does sibling rivalry come about when maybe parents are selective, prejudicial, or show preferential treatment from one to other? How should parents manage that to avoid sibling rivalry, sibling competition, and all those unhealthy traits that put undue pressure on the child or the children?
Thank you so much. To add to what Doc has said, it starts right from the womb.
Okay.
So once the child comes, there's a child already. As human as we are, attention would definitely be divided.
Okay.
This is where you have to, we talk about the problem, we talk about the solution.
Yes.
So this is where you call for help.
Okay.
So traditionally you will realize that it takes one woman to carry a pregnancy, but it takes the entire community to raise that child.
Okay.
So from the moment the news break that this person has given birth, those who will bring water will bring, those who will bring firewood will bring, those who will come and wash and help clean will do that.
Okay.
Just for the woman to be able to pick up and then handle other issues. And it doesn't take only a woman to have a child and raise a child.
Okay.
The male figure is also there.
Okay.
I always talk about age-appropriate communication. Even if your child is a year old and you have another child, there's a way you communicate to that 1-year-old child that the little one, because it's very incapable because of age, needs more attention, which most parents, especially with the black, fail to communicate.
Okay, so what are
It's
some
the
of
same.
things? Yes,
It's the same with even the husband.
Okay.
Men also go through postpartum depression and all those things. Just because some men wish to do it and we push them aside, or we think they can't.
Okay.
So we push, and they worry about it. Some of the issues the women are going through, they do. So it's all boils down to education and communication.
Okay.
This is it. This is the help I need. This is what you can do to help. So you pat the baby right from the womb. After the 6 weeks, the brain develop and then babies start hearing. They don't understand, but they hear the sound, so they can identify the mother's sound, that of the father. If they are siblings, those women who have done that will testify. You rub your belly with a lovely voice and the baby kicks, and you know it.
Okay.
I remember I told a young lady who was battling with schooling and pregnancy, said, speak to the baby when you are on campus so that the baby knows that you don't have much time. And she came to tell me that it's really because she feels the baby kicks just as she enters the hostel.
Oh, okay.
But throughout the day, lectures going up and down, as if there's nothing.
Okay.
So they hear the sounds. When you say you love them, they kick.
Okay.
When there's nothing, so when a woman gets pregnant and say denial and the insult and all those things, it hurts the woman, like Doc said, and it descends to the fetus.
Okay.
And it grows with that. Some children are even born aggressive.
Yes.
Because aggression has been with them before they came. So that's what they know.
It's been part of
It's been part unawarely, or we ignore them and their needs. So parents have to sit and talk about childbirth.
So
family planning. Family planning is all about taking or preventing pregnancies. It's more than that. Where we sit and talk, we want 2 children. In case something happen and we have extra, what do we do? So both parties are aware that there could be that emergency and what we can do. But one person will not get up and blame the other. It brings the choosing and picking. It's this child that I got pregnant and the father got angry and I lost my job, and we associate all those negative things to the children.
I've heard a statement where they say, you look at your good for nothing father. You look like your good for nothing father.
You see?
Or look at your wicked mother. You look like your wicked mother. So then all those things tend to affect the child.
Exactly. So some children are treated differently from the others, especially their accounts have their names, the PCAs and all those things, and then yes, we are human. So we can't treat them equal. But one thing parents should know is your child is
why can't you treat them equal?
It's not in the negative, because children are different. They are unique. So the first girl might have certain weakness and strength compared to the second one in that order. So not that they are not good or not that you don't love them, but based on their strength and their weakness and their needs, that is where the treatment might not be the same. So but not in the negative way because of happenings. You end up blaming the child, and like the child has to be punished or pay for something that somebody, like you are raped and the baby comes out. Now you behave like it's the baby's fault. It is not. So you will need help to get through this. That's because at that point, as human as you are, the emotions are affecting the hormonal fluctuations and all those things, and you need help to calm down.
So how will you take us on the element of competition or comparison, where in a multi-child situation where parents have 2, 3 children or 4, they start comparing one to the other? That's one. Or show, like I say, in PAC or whatever, or mommy's girl or daddy's girl or daddy's boy or mommy's boy, show a preference of one over the other. How must parents behave? We are looking at the solutions in order not to create that, because they may not be aware. They think they're just being themselves. But you spoke about managing the dynamics. I say that parents should treat their children fairly, because you cannot treat them equally, but fairly. Fairness goes beyond equality. What must parents practically do, like this 1 year or 2 year old? Would it be helpful to maybe call the child and whilst you're breastfeeding, let him or her feel that, oh, okay, I'm part of what is going on, even though I'm not the one being held, so that it could all be part of the communication?
Yes. So you see, Doc mentioned that it starts from where we are socialized from. But we can always unlearn and learn and relearn. That is where the difficulty comes in. We get so glued and comfortable to what we know that we struggle to even implement the new things that we have heard, seen, that we know are helpful. So this is why such programs are being organized. We're talking about it today. You don't know. Your children are not the same. They are unique in their own ways. Regardless of their age, there's a language each understands. Capitalize on their strength, even if it is 1 against 30 weakness. Capitalize on the 1. So you can get one strength that will cancel about 15 weakness.
Okay.
It's the same way you can get one negative that rub all there, but it's a human being we're talking about. So there's always something good in any person you encounter. So raise your children fairly, like you said, according to their strength. Do not compare, because the comparison starts the competition. And that is where the sibling rivalry comes in.
Okay.
Call them, sit them down, let them know that for this reason, attention is being given to this one. It doesn't mean I don't like you. It doesn't mean mommy doesn't love you. Sometimes, like you said, do certain activities together. You are singing lullaby to the newborn. Involve the 2-year-old. Clap for your sister. Clap for your... Sometimes even introduce the baby to the existing one. When you return from the hospital or the delivery room, elsewhere they do it better. You see your new sister, your new brother, welcome, let them feel that you acknowledge their presence and they matter. That's where it starts from. So at certain points, children can speak, but the moment you start rolling them, they start responding, even though you might not hear. But the moment you try to talk, they respond with the sound or movement. That is how it starts. So those children who don't get it, sending them to school early comes with it benefit, and then it's negative. Let's weigh the two and know that it has physical health implications as the same way mental health implications. So children who don't get those pattern and their behavior is something. You meet a child and they don't know how to respond to affects. So hello, then the child is looking at you. A child cannot talk, but they can respond to those hello things too, especially people they are familiar with.
I want to take you back on, then I'll come to Doc on how people who have attachment issues can heal or can learn if it's possible. When a child or a baby is young and is taken to the creche early out of convenience because the parents must work, seeing many faces creates the elements of lack of security. Everybody, including babies, need safety and security. So seeing many faces distorts their worldview and their perception of who they usually can open up to. So that creates trust issues when people become adults. So if you are saying there's positive and negative, what are some of the positives? And what can parents do to avert the issue of that element of taking the child to creche early, where they are seeing 3-4 different nanny teachers, and then they come home, parents bring them after work, they have to get used to them, and then they have to get used to the school, and then when they are not performing well, they move them from that one creche to another creche. So at that tender age where they need stability, where they need security, where they need safety, where they need to bond, like Doug mentioned, to the oxytocin and all, it is not present. So they are phased, they are distorted, they are not able to have certainty, and all that affects them. What approach must be used in that situation, balancing the positives, like I would
say that learn to handle such, because in our era it's very important. The first positive is that you, the parent, is at your convenience. The second one is you can trust an environment where you leave your child. However, create and develop norms and values with that little child, regardless of the age. So something unique that when you parent touch your child, you do, that nobody knows. With time, the child identify that this is mommy. So the child can differentiate between the nanny and that of mommy. You have to deliberately, consciously create that, but using certain words, using certain sounds, using certain touches with your child. The moment you go for the child, that should be the first thing.
Again, so how about
and
parents,
when you are leaving the child, there should be something.
How about parents who feel already overextended? They are stressed, their work schedule is heavy, so they are out, as it were, outsourcing the care in quotes. So they take the child to the creche, leave the child there, come pick him or her after work, and then bring the child home, and then it's a nanny or a caregiver who attends to the child. How then is that going to help the attachment? Because they are dealing with the nanny, they are dealing with caregivers at the creche. How unnerving or inappropriate is it, and what steps must parents do? Despite the fact that they are stressed, must they understand what they are saying and must they do it, or can they continue to outsource?
I will encourage that if you want your child to develop well, like we are talking about, then create. There's no time for anything. We create. The 24 hours is created. So you create the time. It's not about how long, but it's about creating the time, being deliberate and planning. There are times, you see, you can't eat your cake and have it. It's everywhere, and parenting is another area. You cannot be a parent and live your life anyhow or as a single person. So it means that deliberately sacrificing something for the well-being of the reason why you wake up at the time you wake up and go out there to work hard. Else you will work hard and there will be no results, or you wouldn't like the results. So be intentional. And it's not about the father or the mother. Both. Call for the right help. You know, years back, people were using help, but when it comes to taking care of children, the grands and the aunties were more involved than the outsiders, like the maids, the nannies, and those things. The grands were there. At least they know you. Sometimes they even tell you stories about your parents and how they grew up and some of the things they used to do, which a nanny cannot do because they don't know them. And then blood is thicker than water, like we say. When it's a relative, the bonding is a bit different from when it's total worker. So for us to raise the children with less health issues, including mental health, we have to be deliberate.
Awesome. We'll have to go for a break now. When I come back, I'm going to ask Doc how people who have those deficiencies can identify them and how they can, and whether they can get help. And then we'll look at the elements of managing parental dimensions, dealing with their siblings, and how siblings who are in their adolescent years or school years can deal with each other properly. Then we'll go on to look at marriage and couples and how they can manage it. So please stick and stay. We're taking a break. Keep your comments, queries, questions, contributions coming via WhatsApp on 0539-986-996. This is Farm Life, your regular family enrichment program, live here on City 97.3 FM. We'll be back. Please stick and stay.
City 97.3. More variety.
Ah, my little ones, gather around. Once upon a time in the heart of Accra, a man in his fancy car sought directions. But oh, the Ghanaian way.
Hello, bro. Good afternoon. Can you please show me where the Presby Church is?
Go straight. Turn left at the big mango tree with the broken branches with most of the mangoes falling. Ask there. Anybody will show you.
And when the Black Stars take to the field, every Ghanaian becomes a coach. Ah, the sacred cue for our beloved Gobe. As you wait patiently, rehearsing the perfect vibes. These, my dear ones, are some few moments that make our Ghana truly special. And as we share these stories, let us also remember a plate of lily rice, connecting our hearts through the flavors of our culture. Special moments are worth celebrating with lily rice. Lily rice, ye nimno free tete. This advert is FDA approved.
Thank you for sticking and staying. We are right back. So yes, Doc, I was saying, how can a parent identify that they have such attachment deficiencies when it comes to being insecure, or they are at the avoidant kind, or some of them are even aggressive, some are passive aggressive, some are aggressive as I choose to call them, and some are avoidant, some are dismissive. How can they know, a parent or both parents or one parent, know that they have those tendencies? That's one. And two, can they work on it and be better so they can be better parents?
Okay, so how would you know? There are several things. One is what we call self-awareness. At some point, you need to have an honest but non-judgmental evaluation of everything around you. Right? What it means is that you need to start paying attention to yourself and why you do what you do. So you may be avoiding relationships, you may be overly sensitive, overly emotional, you may have anger problems, you may hypervigilant is when you're always watching over your shoulder to see whether there's something wrong. Particularly those who have insecure attachments. Right? You may be more dismissive, you may not get involved in your kids' life. There are some people who are coming home and they are avoiding some contact or interaction even with their own children because they don't even understand what is happening with them. So you may find out that you are a bit dysfunctional when it comes to having solid relationship with your children or your spouse. Right? So it comes with this non-judgmental self-awareness. You need to have that conversation with yourself. The second one is that you need to also listen to feedback, from your spouse and from your kids. And you find out that most of the complaints around your kids will be the fact that you are not in their lives in ways that is meaningful to them. And they will tell you. Then third, you may replace actual human interaction and relationship with things like your phone, with your work, with substances of abuse or something. You realize that now instead of spending time with people, you want to be more by yourself or spend with work or something that you may think is productive and is coming. And most of the excuses, I'm busy. It's avoidance. They are just avoiding interaction with their family. Right? And so you may see that you are actually using proper human relationship. You are replacing it with other things that may not be in that sense. And so these are some. So it comes with that self-awareness and feedback from other people, right? It may be a colleague, it may be family, even your children. Your children, see, if you have conversations with your children, they will tell you things. So. I do that a lot, where you call them and even take a walk. And ask them, hey, Charlie, how am I doing? They will tell you things. If you've actually established that relationship, they will tell you things. That sometimes you talk to them, or sometimes you are not around, sometimes you come home and you are this. They will tell you. You see, and kids really don't lie. I'm
laughing. Sometimes, while we are going, sometimes we tell Daddy, you spoil the atmosphere.
Right, and feedback, particularly from others, actually helps you get to know. Because sometimes you yourself are not aware of some of the things that is happening unless someone tells you.
Why is it that people find it difficult to take feedback graciously?
It's I would say it's a defense mechanism. People have a certain emotions around things. So it is just the fear of being exposed, being vulnerable. It's kind of defense. And it depends on how you've grown up. If you've had identity problems, self-perception problems, you've been criticized all your life. It's the feeling around that feedback that people really want to avoid, because it exposes them and makes them vulnerable in some way. And you may be the head of an institution, and you come home and your wife is telling you that you are not good enough, and it's the truth. And that mismatch. You go to work and everybody's carrying your bag. You come home and you have to be naked in front of someone. Naked in the sense that you have to be vulnerable. It's not an easy thing. And usually it's more of self-preservation. It takes a certain level of maturity to be able to strike a balance or the difference. Otherwise it won't work.
And sometimes too is the communication style. And the judgmental and then labeling and the tagging and the stigma also could make it difficult for people to even understand what exactly you're trying to talk about. And
I often say that receive the message, take the emotion out and take the information, because it needs that. Because sometimes the carrier of the message may not also deliver it always the way you want it. But that notwithstanding, if you want to be better, take the feedback graciously, remove the emotion, whatever it came out of anger, out of sadness, out of criticism, and then take the information that you don't bond with the children, that you are always avoidant. Take that, or you are often avoidant. Take that. Anyway, now let's come to the next one. Is it possible for somebody who has had that or experiencing this particular typical nature of avoidance, dismissive, aggressive, or passive posture, to change that posture so they can be more involved as parents, so they can raise their children well?
Yeah, it's possible. There's something we call neuroplasticity.
Okay.
It's a concept where, the brain actually forms its own connections.
Okay.
And the brain actually is able to, the brain is not static. It's not hard. It's malleable. It's able to change. It's able to adapt. There are all kinds of new connections that can happen. Anybody can change. Anybody can be better if they are willing, because the brain is capable. And that is why you may pick someone from a very, very bad background, bring them, nurture them, and they adapt. You depend, regardless of who you are, you show up in a certain work environment, and within a few weeks, you become like everybody at the work in terms of how you're able to do. So the brain is one of the things that God gave us that really helps. So mindset itself is dysfunctional if it's not in a good way. Right, when your mind is fixated on things, and that's how I am, I cannot change. It's not true. It's not true.
So
you are unwilling.
So that's an unwillingness.
Yeah, you are not willing.
An lack of ability.
The brain has the
unwillingness.
capacity. Anybody can show up anyway. So, for example, you may have a parent who has been very difficult all his life. Everybody has been complaining. You can actually adapt. There are people who learn, like she said, relearn. They are ready to adapt. They are ready to accept feedback and make progress. Everybody can.
Okay.
Right. And it starts from there. The willingness to actually make some changes is where it starts from.
So it's often the lack of willingness, not the lack of ability.
Lack of willingness.
And I think the three things to do to be able to identify where you are coming from is the first, and non-judgmental self-awareness, to the feedback from others, including your spouse and children.
Yes.
And then three, replacing the third part is when you replace actual human relationships with things, whatever the things are. Okay, awesome. Now I would want us to and Lady G, I'm coming on you, and then we'll move on to the marriage.
Okay.
And then we'll take the messages and then open the phone lines and
but before she comes in, I think I forgot there was something I wanted to add to.
Okay.
What parents do that even sibling rivalry.
There
was one thing I wanted to add. Was the fact that when you pair performance with love, it creates problems.
Okay.
What I mean is that he gets 100%, you hug him. He gets 50%, you don't hug him.
Yes.
Now you've paired performance with love.
Okay.
And that can actually create problems.
Okay.
So what it means is that the sister gets 100%, you hug her. The boy gets 50%, you don't hug her.
Okay.
So now you are pairing performance with love. It damages them.
Okay.
So regardless of their performance, we love you anyway, we hug you anyway.
Okay.
But we go into a conversation about the performance.
So
separate love from performance. Unfortunately, that's what we do. If you do well in school, I'll buy you this. It sounds okay, but what it does is that performance becomes transactional. And those kids, when they grow up, you realize that they need validation from others to feel better. That's where peer influence and other influences come up. But if someone feels that I'm loved anyway,
in spite of,
but I have to do well.
Okay.
It's better.
Will you go along with the principle that often we share here, that parents must give unconditional love?
Unconditional. Imagine God, His love is conditional.
How will life be?
But some parents say you didn't do well, so I'm not taking you this, I'm not giving you that.
No. So we don't pair performance with love. Otherwise, those people, they grow up and they need validation from others to feel better. And when the person is married, it means that every single statement from the husband or the wife is what spurs them on. They don't become emotionally independent when it comes to love. Right, and you find out that there's even in the university, you go and people are dating people they are not supposed to date. People do all kinds of things on social media just to be able to find validation. Because they themselves are not okay. And it stretches even into workplace.
Okay.
You find any boss or any worker who is vindictive, who is manipulative, right, who loves the post and uses it to lie. It's a sign that they have identity problems. Because they feed on that to be able to feel good about themselves. The more others are down, the more they feel better, because it gives them a sense of fulfillment, right, and accomplishment. Even competitiveness at school, it's like that. And even with that, let me mention that one of the things, it even stretches to the school.
Okay.
The schools that have this system,
Yes.
A, B, C, D.
Yes.
The A students are the
good.
best students,
Yes.
and they've categorized.
Yes.
It's one of the worst things that can happen to children.
Okay.
Right? So you go to certain schools, they've actually ranked
with
the
different
schools
uniforms.
with different uniforms,
Okay.
or even so these the top students are in the A class, like that.
Okay.
It actually damages the kids. Imagine you going to school and everybody knows you are going to the D class.
Okay.
And I tell some of those schools that we need to also share the teachers. A, B, C, D.
Yes.
So that they know how it feels like.
Okay. So you know the high performing and low performing.
Yeah,
okay.
so if you're a teacher and you're not good enough, we put you at D, so that you know. So once you're going, everybody knows that this is a D teacher.
Yes.
Right? It damages performance and love.
Yes.
Damages the kids whilst they are growing up.
Awesome. Yes, if you're just joining us, this is Farm Life, your regular family enrichment program, live here on City 97.3 FM. And we are discussing mental health in the family with Ms. Dr. Isaac Newman Arthur and Lady Justina Owu-Agyiri, and we've had some interesting conversations so far. We've dwelt on the children. I'm going to let Lady J make that last part statement on how to manage the sibling-to-sibling issues, because now when they are in their school years and then they become adolescents and then they are young adults, there's some interaction, they become teenagers and all. What must the dynamic between children be? When we're speaking about what parents must do or not do, what must siblings do among themselves? What must they do? Yes. Then we'll go on to look at the couples.
Thank you so much. You see, children are being raised by an adult.
Okay.
And whatever they see the adults do, they mimic unawarely or awarely.
Okay.
So that's the starting point. So Doc mentioned parent performance with awareness. It's not necessary.
Okay.
Sometimes we have to focus on the effort people put in to get to that 20%.
Okay.
And the effort, not just the results.
Okay.
Because the learning is in the effort.
Okay.
So if they can master it at 20% and do it well, it's better than doing it anyhow and arrive at. So that is it.
Okay.
Again, love is unconditional.
Okay.
So you have to let your children know. I think 3 days ago I was telling somebody that I don't have issue with men having multiple children, affair, whatever. Whatever you choose.
Why don't you have to?
No, what I'm saying is that however you want to live your life, in between you and your creator.
Okay.
But the children that come in, even if they are from 20, 50 women, make sure your children know themselves as siblings.
Okay.
They see each other as my blood, regardless of who their mother is.
Even their mothers not allowed?
You have to, once you are being responsible, except you have decided not to be responsible, it's part of the responsibility to make them know that we are.
Okay.
And I am because you
as
are.
A whole topic
Yes.
Time,
it's something we have to work on.
Okay, all right.
Because God who created us never loved us unconditionally. But then the flood has cleared all of us. Unconditional.
Okay, all right.
So you train the Bible says train the child the way they should go. The Bible said the older women should train the younger women how to love their husband. Training matters. So we have to inculcate this into the young ones, so that they know that the fact that you didn't give me your water doesn't make me your enemy. The fact that I like red and you don't like doesn't make you my enemy. The fact that I can do A and you cannot do it does not. However, if I can, I support you to do what you want to do and do it better, especially when it will benefit all of us in the end.
So siblings should be supportive of each other,
not as competitors. But it takes the parent to inculcate this in them, and we should be deliberate about it. So they will fight because they are human beings. It's okay for them to fight, but help them learn how to resolve. So that they grow with it. So no matter, I know a family, if you try to settle their score, you'll be a third person. In that 20 minutes ago, they have pulled cutlasses and they are fighting each other. The next 5 minutes they are eating together.
But cutlass is dangerous.
It's strange.
Anyway, let's give a disclaimer. Don't put cutlasses on each other because that can be dangerous.
Yes,
because this radio, just let somebody think that it's normal. It's not good to put a cutlass. Even when you're angry, don't. manage your anger, but walk away.
So
Don't
this
put the
is
colours
where
or
parents
knife.
should have made corrections.
Yes.
That
I get
you
but
get
just for the
angry,
record,
but you
yes.
don't pull a weapon.
Yes.
No
So please
matter
don't.
what, because
Yes.
it is not within your jurisdiction. It's somebody's job. Even if you think the person is wrong,
Yes.
even if you think the person is the worst person, you don't have that power. You don't have that right.
Awesome. Okay. All right.
And
Great.
from the word go, you
Yes.
should let them know. Some children get angry and they throw things. They push everything around them, put themselves down, throw tantrums, and we have to help them to understand it's okay to feel bad, but it doesn't mean hurt yourself or hurt another person.
Awesome. So that's the siblings must be considerate of each other. They must not engage in extreme forms of difference in fighting or whatever, and use dangerous weapons, but they must understand that they are a team and working together and not be at each other's. And then they must realize that they're not competitors. And they are saying that depends on how the parents raise them. Because the parents put the competition posture in them, then they will see themselves as competitors rather than as completers, working together and develop their family. Or making a family work. Okay, all right. Now we're going to go on to the second part, which is about this couple, marriage, which is a big one. When Doc was mentioning the 4 kinds of health, he mentioned social health, then spoke about the dynamics of marriage, of friendships, of work, of intimate relationships and all. Then you came into the mental health and how that triggers us. I want us to now go on to marriage, because that is often where it begins and how that affects the couple. So what are some of the stresses, Doc? Yes. Doc, please let me announce. Please keep your messages, questions, comments, queries coming via WhatsApp on 0539 986 996. Not 054, 0539 986 996. Again, 0539. Not the old number if you had it. There's a difference in one letter, one figure. The 4 is now 3. So 0539 986 996. Let's hear from you. If you have questions for Doc or Lady J, let it come and let's do it together. All right, Doc, please carry on. Yes.
So I think marriage is a whole. It's a whole topic for you can discuss it, but I usually focus on the foundational problems.
Okay.
Right. Most of the marital issues are symptoms of foundational problems.
Okay.
Right. And there are 2 cardinal foundational problems when it comes to marriage. And the first one I will talk about is what I call harmony. Harmony in the sense of compatibility. It's a foundational problem. What it means is that you meet someone who is different, you are different. And the 2 of you, your difference complement each other. It's a foundational problem. If you marry the wrong person, no counseling principle will work. You will try and try and try. It's difficult. And if, for example, you go into the Bible, Genesis 2 verse 18, that is where the concept was actually introduced. It's not good for the man to be alone. I will make him a helper. Amplified version will stretch it and say one who balances him. You know, you have a scale. You know, the 2 sources, the one you see in the law courts. Right. You put 50 kg here, there should be 50 kg here. But if you are 80 kg and the other person is 50 kg, that difference creates problem. I'll make for him one who balances, a counterpart who is suitable and complementary for him. So you can marry a good person who is not suitable. And that's why sometimes you find 2 people who are not too correct too, but they found each other. And they can actually be married for 50 years. They may have the normal challenges in marriage, but it's a good marriage. You may find someone who, you know, that's why not every marriage that is working is a Christian marriage. Right? Or there are people who don't even believe in God. They have a good marriage. Right? Because that marriage itself, the principles of what God has set up, regardless of who you are, the moment you apply it works. So compatibility is a big thing. And that is where the term agreeable comes up. Right? Where the 2 of you can actually have meaningful conversations, and be able to resolve issues because you're compatible. It's a foundational problem, and that leads to all the stresses, right? Because the same guy who says has communication challenges with his wife communicates better with another person. So the issue is not communication. It's the fact that you are dwelling with someone who you are not compatible. It starts from unfortunately, we don't look at compatibility when we are married. We look at, he's a good man, but can you live with him? Oh, he's a lawyer. Oh, she's a nurse. She's a doctor. Can you live with him? And that is why you may have two pastors, lady pastor and Reverend Bishop pastor. Right, and they cannot dwell together in the same house because the differences are wide. And marriage is so physical and so practical on a day-to-day basis. Right, you are living with someone and there are differences. That creates a lot of problems. Right, so compatibility, I think, is one of the biggest foundational problems. The second one that I think is also important foundational problem is what I call capacity to perform. Right, because whoever you are marrying should have the capacity to do what you're expecting them to do. Right, so you are expecting that man to be romantic, but the capacity to be romantic is not there because it was never developed. You have this guy who struggled all his life, never played, never had fun, never knew how life was. The feelings around play and happiness and stuff never developed it. And you're expecting him suddenly take you for dinner dates and night. It won't work. He doesn't have the capacity to do it. A lot of fathers are not fathers because they never had a father. So the capacity to be a father is limited. Right? A lot of people, you marry someone who's never said sorry all his life, and suddenly he marries and asks him to say sorry. Right? You've had someone growing up never said, what you call thank you all his life, and you expect him suddenly. You marry someone who has been smoking and drinking all his life, and you suddenly marry and he wants to stop smoking and drink. It doesn't work that way. So the capacity to perform. You marry someone who thinks a traditional man, he doesn't go to the kitchen, and suddenly you want him to help you at the kitchen. It won't work that way. Right? You marry someone who can't cook, who can't tidy, and suddenly he shows up and you want him to, or you want her to cook or tidy, or it doesn't work that way. So capacity to perform is what helps meet all the expectations and stuff. So really, people are marrying people who are not capable of doing what they're expecting those people to do. And we say, but we can adjust, we can learn. It's not that easy. His parents failed. Right? Even he's been in church for years. And really, the pastor is struggling to even make sense out of life for him. And you marry him and expect him to change. So who you choose is what you get.
So you've chosen. You've been in it for 5 years, 10 years. What is the way to make it work?
Well, the way to make it work is not to marry the person in the first place.
But if you have,
then you have a long journey, have a lot of work to do. What means that the two of them will now have to start focusing on standards, not what I think or what I feel. So, for example, we have standards for financial whatever success. We have principles for it, right? We know about savings, we know about investments, we know about setting up businesses, whatever. Those are standards to break through financially, right? And so for you are going to work, let's say you're a doctor or a nurse or a teacher, there are principles for a good doctor in terms of practice. A good banker, there are principles. We go to school for it. The only thing we don't go to school for, which is important, is marriage. So the same attitude. Okay, this is marriage. How do marriages work? Now, can we all learn that so that we can become better with our marriages? That is the way forward. So now it's not like I'm a traditional woman. I don't go to the kitchen. But really, okay, if marriages will have to work, how do we support each other at home? So that one person is not overburdened. When it comes to finances in marriage, what is the principle in terms of financial management in marriage? When it comes to home care, what is the financial home care principles? How do we fix these things? Right? So it starts by people focusing on not themselves, but focusing on the principles or the standards for whatever they are involved in. Imagine setting up a business and you don't know how businesses are set up. You learn how to set up business. So that is what works. Otherwise, there is no, because the differences are wide. Okay. Right? Particularly if you are not if you are compatible with the person, it's easier to fix the issues. You know, it's easier to have a conversation. It's easier to what do you call it? That is why you may find a criminal who is successfully married.
Okay.
Because he's found his match.
Okay.
You know, you find most of these big drug laws you find in other countries and stuff. They have families they go to and laugh. They can go and shoot other people and come home and come and protect their own family. And they may actually have a woman in their life, and they are doing well. Okay. Because they've been able to marry. They are different because they are compatible. So I think that it starts from there. You know, where the two of you actually are honest with each other, and non-judgmentally evaluate your challenges, right? And now you focus on standards. Let me give you an example. One critical area, for example, people grew up from a certain home. They all eat fufu every Sunday. That is their default nature. You marry and you have someone who also eats jollof every Sunday. That is a difference. Yes. Now the question is, it's not about jollof or fufu, but how do families work when it comes to food? Okay. Right. You have what do you call, like what we are even talking about children, raising children. Yes. Right. There's a standard for raising children. Now it's not like, oh, this is how I grew up. Yes. This is how you grew up. But can we all focus on the standard?
So then, is it the case then that because we are not choosing to be learners, and we are choosing to stay in a perceived or known functions, that is also a big issue.
Perfect. And we don't understand that we need to learn. If we don't know much, for me talking plenty, you know, I don't know much. You know, learning until we die, we're still learning. And I'm saying that couples pay attention to other aspects of their lives. Yes. Finance, they are always learning, they are improving. Career, always learning, improving. Yes. But when it comes to marriage, if we also use the same attitude, that, okay, marriage is a serious business, right? We need to learn how marriages work. We need to learn how things work, right? And both of them are committed to learning and applying that standard. It works. I'll give you another example. You know, for some families, you visit them, and when you get to the house, they remove the slippers or the shoes in front of the door. Yes. There is a reason. They will say, okay, if you would be them. So they have a way of putting it there. Other people too, they enter the house with their shoes. Yes. And there's a shoe rack, you know, and they arrange it nicely there. You imagine you marry someone who does shoe rack and another person who does in front of the door. Yes. That would be a major conflict. Because the person who comes here and sees the shoes all the time there may wonder, what's this shoe doing here? You create problems. Exactly. Now, okay, how do we fix this problem? Okay. Now go and read, the two of you. Yes. How can we arrange shoes in such a way that the place will be so nice and neat that visitors coming won't create problems? Okay. Now, it's not about me doing this and we doing this. And obviously, you may find that your spouse may be good at something. Yes. You may be good at something. Yes. How can we learn from each other based on the standards, not based on where we are coming from? Okay. And that will translate into raising the kids in a way that follows the standard, not tradition.
Awesome.
Because not every tradition is okay when it comes to marriage.
Awesome. So if I'm hearing you right, you're saying the solution is that focus on the standards, not on what you know or what you prefer.
Yes.
And then both of you need to get yourself to a point where you are aligning on the standards, because each one has their culture, their tradition, their preferences, and then their conventions that may not be suitable to create the bond or the cohesion needed for the family or the marriage. Number two, you are saying that when people apply the principles as a worker or a banker, those principles function and get good outcomes. So those principles aligned to the standards, like you're saying, is what the couple must focus on to manage their differences, because then it's like hot and cold. Don't just focus on the hot and cold, but focus on what can you do to make it functional. So the functionality must supersede the preference.
Yes.
Okay, awesome. And then you're saying that the elements of honesty, non-judgmental evaluation, where you can have a non-aggressive or non-emotional conversation, a non-judgmental, or not calling each other names or pointing who is right or wrong, so that then you can move on from there. And you're saying that we should use the same attitude that we use in professional and personal development and in marriage development as well. Then we can get with the outcomes.
Yes.
Okay, right. So please let me go on the console, take some messages, and then let me announce the phone lines are activated. I open, please, 0539 986 996. The foundational issues. So that's where Doc took us from. See the foundational issues, the harmony, which is linked to the capacity, compatibility, and how the differences are managed, because then once we don't are able to complement each other. Then the second one is the capacity to perform. So your expectations are linked to the capacity of the other person to perform, and so when that is not managed well, if it flows easy, it comes easy. But if it doesn't flow easy, then we have to do the things that you mentioned. Awesome. So Daniel New, that Brighton from Gomwa Budumbram says, thank you for educating us, telling us about the child right from the womb. I'm a carrier of sickle cells. My wife, we don't know. Recently, my twin daughter told me there was a medical checkup at their workplace, and they detected that they are both sickle cells and how both of them have the same cells. Okay, listen to the doctor in saying the child predicament starts right from the womb and at birth. What do we say about children born with autism? Does it mean an autism child wasn't handled well at pregnancy and at birth? So Dr. Newman, please take note so you address it. Yes, please, let's go on. Abner from Spintex says, good morning. So I want to give you some paper, so if you want to write it, please write. But I want to read all of them before we start addressing it. Yes.
Okay.
So lady, you use your tablet, and you are there. Abner from Spintex says, good morning, Farm Life. Thank you for this topic. Growing up, I was told I was not breastfed. My maternal relatives literally took me from my mom when I was a baby. I've not known my father. A little background. My mom has a mental condition, so after my birth, I'm told she was just taking me around even when I was not set to be out. They had no option than to take me from her so that someone doesn't steal me from her. That's their reason, and I think it's fair. Now I've grown in my 20s. I stayed with relatives and I was tagged as very secretive. I've realized I'm very emotional and very keen on who I share and bond with. Now, to choose a male partner for marriage, I don't know if I'm very hard with men that come around because I didn't know my dad. I don't hate men, but I want my children to experience and have what I didn't have. That's parental love and bonding. This has made me very hard in choosing the men. I've created this standard. If you don't meet it, you are ghosted. Is it a good approach, or is there something better I can do? Kindly advise me. All right, now let's take the next one. This essay says, good morning, Farm Life. Is it okay for a stay-at-home husband to emotionally abuse his wife and even tell her she's not sensible one bit? That's essay's question to both of you. And then Johnny Edem says, sorry, this might be off topic, but how does one become a clinical health psychologist from studying general science in SHS? What next? Okay, so Doc, that will be to you because that's your area. So those are the ones. So please answer them and then we'll open. The phone lines, the phone lines are active. 0539 986 996. Again, 0539 986 996. Yes, so let's start from the top and so they can address yes.
Yeah, so the first one is about autism. Autism is one of the most talked about child-related problems in terms of what causes and stuff. Okay. Currently, there are plenty debates around it. Okay. But what is clear now is that most of them have some genetic problems due to some growth problems from the womb. Okay. Right. Then again, if you have a relative who has autism, you are likely to also have. So there's some genetic linkage. Right. Then again, to maternal problems, like all the things you said, when a woman is pregnant, right, they are not supposed to take this, they take. They have some infections, they don't manage them well. Some pollution here and there. So those who are preterm and stuff, they are more likely to have autism and stuff. Some are trying to even link it around childbirth related issues like I talked about. I've seen a lot of clients who come with autism related problems and cerebral palsy because of labor related problems like I talked about. Now one of the big debatable issues is where people are even trying to link childhood vaccinations to autism and stuff, and most of those things are not conclusive, right? So it's one of the most debated areas when it comes to autism. But we know that primarily based on poor growth in the womb, children may have autism. Okay.
So yes, let me ask. Some people say that sometimes when the woman grows much older before she
so maternal advanced
that also can
I forgot to add advanced maternal age. When the woman crosses 35 before giving birth, there are all kinds of genetic issues that can happen.
So as a doctor,
it's a critical
you
one.
You are both a medical doctor and you are also a clinical, so you are able to combine the two very wonderfully. I'm thankful for your being here. Would you also have had a number of gynecologists come in studio and encourage wives or women who want to progress in their career and yet want to have children, marry, to realign their posture? Because like you are saying that by the time you are of age and they say people come to them with money and say, make me pregnant, and they test the egg and do all the tests and realize that no, it's not a good thing. The timing is wrong. So would you add your voice? Do you agree with them that if a woman cannot be like a man, because a man can still have children when he's old, but a woman's egg production and quality decreases when she's old? Please speak to that.
Yeah. So peak fertility, fertility is in your 20s.
Okay.
That's when you are most fertile. That is why most of these university girls and most of these, the moment they attempt, they are pregnant. Right? So peak fertility is in your 20s. The moment you cross 30, everything starts coming down. So there is some wisdom. People say societal pressure. No, there's some wisdom when you marry. Your family members start coming after you. When is the baby coming? Right? Though it looks like societal pressure, but there's some wisdom. Those days they didn't have all this scientific backing, but they knew that a woman's time is actually limited. And let me say this: there are two things that may come up in terms of your own growth that younger people now are not taking serious. When you are at a certain age, marriage will come up. When you are in your 40s or 50s or 60s, and the sound of music is gone, you can't run around. There are things that would hit you. Right now you are young, it may not. Marriage, whether you married or not, and two children, whether you had kids or not, it's biological, it's natural, and you can't defeat that. As now you may find out, I don't need a child, I don't need marriage, but as you grow older, it's going to come up at some point. So if those things are essential, then the earlier you actually have it, the better, particularly when it comes to kids. Because for Ghana, for example, you may find that menopause, meaning that everything is now subsiding, is around mid 40s, but some may start as early as 38.
Really?
Right, 38, between 38 to about 55. Average is around mid 40s. So majority of Ghanaians who have their menopause around 43, 44, 45, 46, 47, they're about. Right, so you don't have time. Right, and so if making babies is important, have to. And again, let me say this: that getting pregnant is not that simple. There are some women who have been having their mens, they think that they can become pregnant, but it's not that simple. So when you marry, the advice is that start attempting to have children early, so that in case there's a problem, we have time to fix it. So it's better you delay a master's program or a PhD to have, let's say, a child. Then through the process, you start pursuing those because you don't have time. But if you let's say you marry at 28, you say, oh, you have some PhD or some master's or whatever, before you realize you're 32.
Yes.
Now you start you want to have kids, and there's a problem.
Yes.
Now you are 32. It may take us about 3 years to fix it. You are 35, or even 6 or 7 years before you realize you are approaching 40. And the more you approach 40, your 40s, the less quality your eggs and the more available your eggs. So the earlier you start, the better. You know, so there's wisdom in what our parents do. We may say, oh, societal pressure. You're putting no. It's wisdom. They are trying to tell you that you don't have time.
But what I want to add to this is that I'll go a bit away from what Doc is saying, from mental health perspective. Don't let this be your headache, because it's not everybody that will get.
No,
that's also. But if not, it becomes like a competition.
I hear you. Let me say it before you come in. I don't think he's making a point. He's saying that if you want to, so it's optional.
Yeah.
If not, you see, why we are saying it is because I engage people. I've said I've had different colleagues come into studio, and they've all said the same thing. So he's only supporting that principle. It's not a force. Yeah. So what we are saying is, if you want to marry. If you want to have children, have children. But don't do it, and at the end you make your partner suffer, and then both of you suffer. Because if you don't want to have children, sometimes some people want and they don't get. That's also possible. But I'm not allowing you to go into it because it's a fact of life. If you want to, some people want to get married, and that's a preference that men have over women. A man chooses, a woman accepts. But now women are trying to turn it, and women are trying to choose, and they get a man to accept. Whatever cycle it is, there must be an agreement for the thing to work. If you don't get, that's what comes to you. Some people want and they don't get, and that's life. Say get what want no get no want. So that's the reality of life. But we are not saying that feel stressed if you don't get, or feel stressed if you don't want. But we are saying that in the event that you eventually will want, then earlier is better. I don't want us to drag that matter, but that's the issue. Or Doc, I'm not.
Yeah. So I think from her point, it's like sometimes people become overly anxious and worried when they are not, and that anxiety may actually force them into things that they don't want to.
Yes.
But whatever it is, if I don't even want to use the word if you want a child, like I said earlier, at some point, some part of you would want what is your own, right? And that is what I've noticed. So there are some women or some guys who at the early age, the fun of life, you can run around, get any girl you want, get any man you want, and stuff like that. As you grow older, you realize that those things don't come as easy as it is. Now you sit down and your evaluation is around, hey, could I have married? Or could I have had kids? It will come up at some point. So if now you think it's not important, one day it will be important.
Awesome. So now let's get to managing the stresses. So there's intimacy, there's finance, there's leisure, there's bonding.
Yes.
How do this, and then there's the pressure of work, travel time. I mean, there's a particular place that I go a bit out of Accra. I mean, when I try to go there during the day, it can take me anything between 3 to 4 hours to get there. When I go at dawn, and sometimes I leave home like 2 a.m. or 3 a.m. or the recent I left home at like 5 a.m. It takes me an hour and 15 minutes. So travel time to work can be crazy. So the stresses of life, work, home, family, spouse balance. How must that be handled to help the mental health of a couple?
So let me go to a foundational problem with this. There is what we call emotional and stress regulation, right? The body should have the capacity to regulate. Some people don't have it.
Okay.
What I mean is that whenever we all go through stresses, we are able to, the body marshals its internal mechanisms to help us cope.
Okay.
We call the stress response.
Okay.
Unfortunately, some people don't have that, the capacity to regulate stress.
Okay.
And there are two dimensions to that. The first one is biological.
Okay.
Right? Biological means that the body systems itself should have the capacity to regulate stress. Unfortunately, some people don't have that. And it may stem from two things. One, what was passed on to you by parents. There's a concept called epigenetics, right? Where when a parent actually goes through traumatic experiences, it changes how genes are expressed, particularly genes for stress and emotional regulation. Right? What it means that there are certain genes that helps you able to emotionally or regulate stress. But there can be changes in how those genes are expressed. Right from parents who never healed from trauma. And those genetic problems can actually be transferred to the child. Right. So some children are born and they don't have the capacity to regulate stresses. And so you may find out that right from childhood, you find out this child, almost every stressful situation is a big thing for them because the capacity to is not there. So there's a genetic component when it comes to ability to regulate stresses. That is also there. Then again, what we call another thing about stress regulation is what we call adversity quotient. There are different types of intelligence, right? Ability to navigate life. That is intelligence. We have the normal IQ, which is normal in the ability to think, to judge, to remember and stuff. And that is what is tested in schools. We have EQ, emotional intelligence, ability to manage your own emotions and that of others. We have social intelligence, navigate social relationships. Right. Then we have spiritual intelligence, also another concept that is coming up. Right. Then the fifth one, and there are several others, but the fifth critical one is what we call adversity quotient, the intelligence to navigate adversities. And it's developed from childhood.
Please help me. I'm trying to spell the word quotient. My mind is not able to spell it.
Oh, it's Quotient. Quotient. Like intelligence quotient.
Yes.
I'm sure
for just a moment now, the word quotient I can't spell.
I'm sure someone is also struggling at home.
It happens.
Not because I don't know how to spell it, but suddenly it's not coming together.
Maybe this morning you are stressed. Maybe you didn't sleep well.
Because black stars make me sleep.
That's right. Right. So there's something we call adversity quotient, and I think parents should listen carefully. Listen carefully. Right. Adversity is the intelligence that helps you to navigate the difficulties of life. That is where we develop the concept of mental resilience from. Ability to adjust, cope and adjust, to recover, to persevere, to bounce back. Right? That kind of intelligence is also socially developed from childhood, based on the little things from childhood. Right? So, for example, childhood responsibilities. Okay, get up, go and sweep, go and clean this place, go and do this and go and do that. You are building tenacity, right? A child asks for something, you don't buy it immediately. You delay a bit. You are building patience. You ask them, can you buy this for me? Can you go and do your assignment? Can you do all those things? What is happening is that you are building the child's capacity to handle challenges and difficulties of life. Now, what is happening is that a lot of kids are not developing this kind of intelligence because, we overdo things for them and we overlove them. Right? So when a parent is overloving their kids in the sense that you are always doing things for them, whatever they ask, you are giving it to them. Whatever they need, you are giving it to them. What you're doing is that you are denying them the opportunity to develop that ability to be able to withstand the stresses of life. Right? So you may find a teenager who cannot cook, who cannot wash, who cannot even bath herself. They can't even go to school themselves. They are always in cars going to school with a driver. They can't navigate, road traffic, picking a car themselves. They can't do all that. You are actually denying themselves the opportunity to build this type of intelligence, right? So when parents overdo things for their kids, overlove them, is actually creating problems. That is why you may go to most of these rich homes and the kids can't handle challenges because everything is done for them. So adversity quotient. So if you are married to someone, and for you, for example, you did a lot of house chores whilst you were growing up. You were hungry small. You crossed the street yourself at a certain early age. You walk to school. It means that you have the tenacity to be able to handle some challenges. And imagine your spouse growing up, never did anything for herself or himself, was always carried to school, everything the parents did for them. It means that the two of you have developed different levels of adversity quotient.
Yes.
Now, when the challenges of marriage come,
Yes.
one person may be onboarded,
Yes.
the other person may be overwhelmed,
Yes.
because the two of them develop the capacity to withstand stresses differently, and that can actually affect the marriage.
Okay, great. Please let me take more Togbe and
It looks like we didn't finish answering the
Answer
other
the
questions.
question.
Oh, didn't they? Okay,
Oh,
then
but
let me
you-
take this and you add it quickly, please. So you went on fast. So Togbe and Chikada the second says, does menopausal signs hinder libido in women, and how long does it last? That's one. Then Kweku from Tema says, good morning, Farm Life. Thank you for this topic. I am currently going through a lot as family man, and it has affected my mental, physical, and spiritual health. I don't know what to do or who to turn to. I seriously need help. Then Auntie Anima from Akimodan says, good morning, Farm Life. Thank you for sharing this pressing issue with us. My firstborn used to be the envious type. I spoke with him and he understood me perfectly, and he's now a changed person. Unfortunately, the second-born also started behaving same. I have tried to speak with him severally, but it's not working. He does things his own way at his own time. Any little things trigger him. My problem is he can decide not to speak with anyone for some hours. He can sometimes tell me to my face when I ask him to do something. Mommy, I can't do it. He can speak with me when he feels like, and he expects me to understand him. I'm worried about that behavior because he's just 13 years and I don't want him to grow up with it. What should I do? Then Ken from Amsterdam says, hi, Farm Life team. This statement came up in a conversation with my spouse. If you always want to argue with a woman, if you always want to prove a point to a woman, you will end up in a million relationships, unquote, quote and unquote. This is a statement that was made to me in relation to trying to make a point. All right. So let's put all together and do that all in a jiffy. All the pending issues, yes. So the one who says he needs help, please give me my number, and then later I'll see how to connect him where I can. If I can't, I'll connect him to Lady J, our in-house special help, and then if Dr. Newman also allow me, then I can pass some on to him. Yes.
So I will say, for the sake of our mental well-being,
Yes.
we have to know ourselves and know where we stand.
Okay.
Because life comes in stages. So even in the family, the marriage starts at a certain stage and it evolves.
Okay.
Each stage and the challenge.
Okay.
And how to resolve it. Being able to resolve some of these challenges help you to resolve the other ones. For instance, if you're a woman, there are challenges that comes with being an adolescent, becoming a young woman. If you are able to address those challenges with help, you'll be able to address higher or difficult issues in later life.
Okay.
Like when you enter into marriage, you'll be able to handle certain things better. Like Doc said, when you learn how to cope well, it's flourish.
Yes. Okay.
Sometimes certain things happen in life that breaks that threshold, but you can still rebuild it than when it is not there at all.
Okay,
So be open about your issues to trusted people that can help you. Don't battle it all alone, especially when we all have childhood traumas and adverse effects.
So
For
now
the
let's
sake of
address-
time, that's what.
Okay, so yes, summarize it. Okay, so the woman who says a 13-year-old son can say to her face and not do things.
A poor parent,
Yes.
I think that the
poor
woman
parenting.
would have to seek help,
Seek help.
with a professional.
Okay.
The parent, they have to be guided as to
Parenting
what to
styles,
do.
yeah.
Right? There's a lady who talked about ghosting men and stuff like
Ah,
that.
yes.
I
She
think
said-
that she needs to talk to a professional.
Okay.
We need to do some assessments for her
Okay.
to find out where the issues are coming from.
Okay.
I think we need that. And I think there's another one that talked about, is it okay for a stay-at-home husband to emotionally abuse his wife and even tell her no abuse is okay. This might be after do clinical psychology, so go to the university, do any course in that has psychology in there. Then from there you can pursue a master's course. Johnny Edem, Then does menopausal signs hinder libido? Yes, because estrogen actually reduces. There are 3 types of estrogen actually. The one that takes over is produced by fat cells, menopause. It's not as effective as the estradiol, right? Which is in the younger years. And so libido goes down. There's even dryness down, all kinds of things, mood swings, and and all that. So for how long, it depends on the person. It's different from and for if it's affected, you have to go to the hospital. For some people, menopausal things are too much. People like that, they may need some evaluation from the obstetrician and gynecologist. Then there's another one. I'm currently going to a lot. You will talk to you about it. Akim Oda talks about the children. You need to speak to a professional. Then I think the last one, when your wife says this, it may be a sign that the two of you, the relationship is not going well. Right? It means that the two of you will need some couples therapy, and the wife must be open for a conversation and open to change. And we said that if you say, this is how I am, she's trying the generalization. This is a cognitive distortion. If you always want to prove a point to a woman, you will end up in a million. So he's now adding every woman. No, it's
and
not every woman.
The word always.
Always. You are generalizing. It's a cognitive distortion. People who do that, they have a negative perspective about life, and they are unwilling to change. By adding every other woman, it makes them feel comfortable with what they are doing. Right? It means that woman needs some help. Okay.
Awesome. So let me do a shout out, and then I'll come to finally introduce you guys. And if you also have shout out, so Lead Afrique, that's Letitia, one of us, and they have their leadership farm coming up. So the leadership farm summer camp 2026, they call it the Teen CU edition. And they're saying that, dear parents, your pre-teen or teen could spend the vacation scrolling through social media, or they could spend it learning how to lead, solve problems, create opportunities, manage money, and build a vision for their future. Welcome to Leadership Farm Summer Camp 2026, Teen CU Edition. Leadership Farm is a life-changing experience designed for pre-teens and teens who are ready to think bigger, dream bigger, and become more. Through leadership challenges, entrepreneurial training, money games, team competitions, mentorship, and other exciting camp activities, campers will discover their strengths and develop skills that will serve them for life. The world needs leaders. The future needs innovators. The question is, will your child be one of them? Register them today for Leadership Farm Summer Camp 2016 CU edition. Call or WhatsApp 059 804 3003. Again, 059 804 3003 to secure your spot, or visit leadafrique.org. Leadership Farm Summer Camp. This vacation, don't just keep them busy, prepare them for the future. So the number to call or WhatsApp is 059 804 3003. Again, 059 804 3003. And you can be told what to do, and then you can get your child to participate in line with all the things that we have discussed. I want to also give a shout out to Reverend Nana Folsom, whose birthday is tomorrow. May the Lord bless you. You are an awesome and wonderful man, and keep on being the wonderful guy you are. Amos's 3LC26 camp is ongoing for the ladies, and they are on Twitter, and they are saying that you can follow them up and get acquainted with what they are doing. You can also get a copy of Becoming an Achiever in the Marketplace by Fitzgerald Odonko at the front desk of Channel 1 Television or Harvest Chapel International Tehillah Temple, both in Tesano. And then link up with us and let's come support your team, train them on the various aspects of emotional relational intelligence and all the many things, stress management, team building, and all. So you can have a functional team, you can have functional homes as well. Any shout out anybody wants to give before we run out, please? Then I'll mention your names for the last time. Yes. Doc, you want to do any shout outs?
Well, I think Prof Mauto, my my VC, UPSA,
Okay.
an amazing man,
Okay.
and all the staff of UPSA clinic.
Okay.
I think they are doing so well. UPSA is doing so well. We thank God.
All right. Nice one. Yes, Lady J.
A nice weekend to all those listening to us and all the June borns.
Awesome.
Yes, thank you for giving us a new month.
It's you. Okay, so I've been in the studio with Lady Justina Owu-Agyiri, who you know and hear so often, and Dr. Isaac Newman Arthur, who is here today and shares so much with us. But we hope we'll have him more often. We've been ably produced by and technically produced by Daniel Squashy. My name is Michael Mensah. Please stay tuned for the big issue which is up next, and we'll catch you on the rebound. Bye.
Bye.